let's dive into the discussion of single leg squats to a chair and single leg squats with a kickstand to a chair. I'm Dr. Nichelle Gurley. I'm specialized in prenatal and postnatal movement. So this can be a great tool for not all pregnant women, but for some to work on not only balance, but our pelvic stability. Single-legged work is great to be really making sure that we create balance in our body versus when we do a regular squat. A regular squat to a chair, I'm going to tap down, both legs are working. I don't know which side has an imbalance, which side is weaker than the other. If I do a single leg squat, I really know which side needs a little bit more work. All right, so let's dive into it. I like to first start out with feeling where that chair is. So in my case, I have a bench, but you can use a chair. I'm like, okay, I feel the depth. And then I'm gonna bring my legs a little more narrow. I'm gonna start with a kickstand. You can use a lot of your foot or a little of your foot. So I'm gonna start with a lot of my foot, and nice, slow, and controlled, I'm going to tap down and right back up. I'm not coming down and sitting, staying a while and coming up. It's a tap, chair's there, come right back up. I'm focused on my knee. I wanna make sure it's not dipping in or coming out. I wanna keep it nice and in line. If I can't do that, then we wanna go back to regular chair squats and not do single leg because we don't wanna mess up that knee. So I'm gonna come down again with that kickstand. If I find it starts getting easy, what I can do is just go up onto my toe. So I still have a kickstand, it's not on the ball of my foot. I make it a little bit less of a point of contact, a little harder, and drive up. I like to keep my arms out in front of me for counterbalance. Now, if this is way too easy and you wanna just a little bit more of a challenge, you can lift up your foot. It doesn't have to come up high or do anything crazy. It can just come off the ground, and nice, slow, and controlled, you can sit back down and drive up. And that one is a little hard for me, so that's not something that I would do late in pregnancy. I wouldn't do it without the kickstand, but with a kickstand, it gives a little bit of an extra challenge beyond just doing a chair squat. So that's the single leg squat to a chair and single leg squat with a kickstand.